is it that we want to sustain? And do we really want to sustain what's going on? Or do we actually need to disrupt a fair amount of what's going on in order to get something different?
I've done 20 years, mostly in Africa. I started like an ordinary doctor in a hospital, treating people and bringing drugs and fixing equipment and trying to teach people how to do things. And none of that really worked very well. The moment I turned my back, those things collapsed. So the sustainability of those approaches were very limited and tied to myself as a persona.
After all the aid that we have received, we don't seem to have moved an inch, and to me that is sad, because we could have done so much at the peak of the aid we were getting to make lives better for the people.
In the past, we've very much been operating in a framework in which we thought that the developed world had found quite a good balance in the way societies were built and had a sustainable path of development, and a developing world for which we had to find solutions that were often solutions to sort of band-aid solutions to address famines and epidemics, and we had to save lives and save people. And over the past decade, the world has changed a lot. First, because of the financial crisis and the economic crisis in the richer countries, which are themselves now questioning their own model of development.
We've been looking at health in the next 100 years in a number of discussions that are going on. And it's clear that there is an atmosphere of excitement growing around the health sector, that there is going to be massive changes and innovations, actually game-changing innovations in health that are going to take place.
We are in a point in time at global level, national level, local level, and even regional level, to tap into technology, to tap into society, to tap into our institutions to do things differently, but it needs us to be deliberate about that process.
Better access to technologies and information through technology is maybe a hope I have in actually changing the dynamics, in that I can know what I'm supposed to be getting and where it is available so I can go and claim it. And I think the mobile phone, which is lost in my pocket here, might actually be one factor that we can employ, but I think we shouldn't pin all our hopes on it.
I really believe it's possible to find new models, and I think that many actors are stuck because of their, because of vested interests, because of dogmas, because of principles, values, and that they cannot imagine that we could do things differently. And for me, the bottom line is really the population we want to help and assist. And we have learned, for instance, with performance-based financing, that being innovative can really bring benefits to these people. So I want to keep this inspiration and to move it beyond maybe what I've been doing so far, healthcare financing, and to bring it to new spheres, new domains in global health.
The changing global health architecture is no longer a question of making a very clear distinction between high-income country systems and low-income country systems. We need to think of these as, with globalization, that's one of the very positive aspects of globalization that we've had. We have communities developing across the systems, the different health systems, and we need to foster those communities. We need much more interaction and exchange between the conventional low-income country health systems actors and high-income country health systems actors.
We are on the brink of initiating a kind of platform which can aid the exchange of knowledge. Since some European countries are also experiencing the same health systems challenges in the African and other countries, this could be a platform for them to learn and adapt or adopt some of the innovations that Africa and other low and middle income countries have had to address in the process of coping with their health systems challenges.
Governance issues in getting things delivered and balancing governance with empowered consumers, and that we need that balance. So that on the one hand I know my rights and I can claim them as a consumer, but on the other hand someone is also overseeing the delivery through good governance.
There should be a greater role for national governments and for eventually for communities within countries to have a role in determining the global health architecture. But there should at the same time be, and at the same time there should be a very strong focus on values and ideals.
Maybe it's time for us to put the ideas first and then let the money follow the idea. I think sometimes the monies are flowing, but the ideas are not flowing with the money, and that's probably part of the reason why we don't seem to be making as much impact as we would like to make. So I would like to turn it the other way, that apart from the flow of money, there should be a flow of ideas. And I would almost say the ideas and the capacity should flow before the money. And that is not to say the money is not needed. You desperately need the money, but maybe we need to relook at it.
PBF is creating an ecosystem now. There are African entrepreneurs, European entrepreneurs realizing that there are opportunities there, and they are coming with new ideas.
Performance-based financing has ways of tying both government funding and donor funding into one system. We have two examples of that. In Rwanda and Burundi, both countries have national systems, and about 10 to 11 different donors contribute to financing performance-based financing.
Really creating an environment for health facilities to focus on having an impact, and we use financial incentives. We think that institution matters, incentives matter, and so we pay health the system is about paying health facilities according to their activities and the performance, quantities and quality. Now it's not easy, so you have to create you have to really consider the configuration of the health sector, and not only just to provide a payment mechanism, but giving more autonomy to the health facilities, for instance, and fixing the system. So it's a system-wide intervention that's fascinating.
At the end of the day, you need to integrate performance-based financing in the overall health financing strategy of a country. Now, if you don't do that, you won't succeed.
Indeed, the world is changing, and it's indeed for the aid sector, it's time to reconsider its role, and that it's yes, and there is new space, new opportunities, and we should make sure that they have their chance.
Everybody thinks health is the most important thing in their life, so it should be an issue that the world is concerned about, that people can actually live healthy lives.
We really need to recognize that non-communicable diseases are the most important problem in terms of global health today, and tackling it in a totally different fashion based on appropriate governance mechanisms, accountability, inputting, capacity into the systems, particularly to the health system, but also in terms of the all of government and all of society approach. It's clearly a key element and determinant.
The world population is growing. We are facing a lot of health problems in developing countries, but also in developed countries, where aging is an important problem. And financing all these needs is going to be a big issue. But I also think that with a lot of creative thinking and innovative ways of dealing with it, we can do a lot.